Hello everyone. Today we are going to study the lesson of pyogenic infection of bone and joint. There are three parts of today's lesson. The first is suppurative osteomyelitis. Second is chronic osteomyelitis. The third is tuberculosis of bone and joint. The part 1, suppurative osteomyelitis. The pyogenic bacterium infects periost, cancellous substance, compact bone substance, and marrow. So there are two key points. According to symptom and the cause, we can call it the acute, subacute, and chronic. Then according to the mechanism of infection, there are two parts. One is hematogenous, the second is iatrogenic. The clinical symptom. There are system symptoms such as high fever and chills. The local symptom is local deep tenderness. The patient dare not move, and you can see the red and swollen joint. The clinical examination. First is leukocyte count increase. Then is the blood culture. We can culture the bacteria. And the most important is the third, that means stratified puncture. We can also rely on the image such as X-ray, CT, and MRI. The diagnosis. The clinical diagnosis. First is high fever, and then is the metaphyseal pain, affected part tenderness, leukocyte count increase. So the definite diagnosis is stratified puncture. Etiological diagnosis is culture of pathogenic bacteria. The therapeutic method, 2 points. One is antibiotic, the second is surgery. Part 2, the chronic osteomyelitis. Chronic osteomyelitis is a continuation of acute suppurative osteomyelitis, which cannot be healed even after many years. Look at this picture. This is the 39-year-old man with chronic osteomyelitis of the tibia and adjoining wound. So the operation indication should be 2 points. First is dead bone formation. The second is die cavity formation and sinus suppurating. The surgical contraindication is there are also 2 points. One is acute attack. The second is large dead bone formation, and the formation of the shell is not fully formed. Part 3, tuberculosis of bone and joint. The clinical symptom, the systemic manifestation of tuberculosis poisoning. Most of the lesions were solitary and rare symmetrical. The pathological pain, the pain increased after exercise, referred pain in hip and knee, abscess rupture, then transfer to mixed infection and high fever. The sequela is the joint deformity, the sinus thyrophysis. The complication should be cold abscess, sires, paralysis, pathological fracture, and dislocation. Now is the laboratory examination. The mild anemia, then WBC is normal, but when it's the mixed infection, it's also increased. And the ESR is an important index to detect whether the lesion is stationary or not. From the simple cold abscess aspiration of bacterial culture, positive rate was 70%. But from the mixed culture, positive tuberculosis sires abscess aspiration rate is extremely low. The treatment, there are 3 points, such as supporting treatment and anti-tuberculosis drugs. We have the first-line drug and second-line drug. And then is the time. Basically, that should be at least half a year, sometimes even as long as 2 years duration. And the classification of spinal tuberculosis, there are 2 parts. One is central type. The other is peripheral type. And the tuberculosis of the spine. Look at this MRI. It shows the anterior vertebral body destruction with relative sparing of adjacent discs and an abscess spreading beneath the anterior longitudinal ligament. Okay, that's all. Thank you, everyone.